Things that look like herpes, or is it? Hi, I'm your local OBGYN. I love women, and not everything is herpes, even though it can look like herpes. But then what is it? So, the obvious thing when you go see somebody, if they see these sores that are uncomfortable and they kind of look like ulcers of your vulvar tissue, sometimes near your rear end, sometimes the lips, is that somebody's going to say, hey, have you had a new sexual partner, or have you had this before, because it looks like herpes. But the only way to actually diagnose genital herpes is with a direct swab. So if you do get a direct swab, and it can't be like a wimpy swab, it has to be like you gotta like really get in there with the Q-tip, and it's negative, then we start to say, hey, suspicious. So that's number one. Number two, if somebody gets in there with that Q-tip and swabs, and somebody isn't ready to kick your head off, because if you get that thing swabbed, it should be like excruciatingly painful. Flag goes up again. The other thing is, if you have like a nun, and I have had this before, who has never had this before, and it's suddenly showing up in a later age group, or a young child who has no pain but has one of these things present, and you swab, and again, no pain, negative swab, you gotta stop and think. This may not be what it looks like. If it looks like a duck but does not act like a duck because it's not painful, and it doesn't test like a duck, maybe it's not a duck. Maybe it's something called Lipschitz ulcers, which look just like herpes. And you can see this after viral infections. You can see this mostly in the extremes of age, meaning younger girls and much older women, which really starts to set alarm bells off if you're a provider and you're like, does this child potentially have something like a sexual infection, which should be pretty nerve-wracking, and get a full evaluation anyway to make sure that there's nothing more insidious going on. But then if you have an older woman that gets these all the time and it's constantly negative, Lipschitz ulcers. Look it up. It is not something that you're going to treat with an antiviral. Stop freaking people out that maybe it's herpes, because maybe it's not.